I was damn straight sleeping on bark dust next to the building I used to live in. I didn't have any money, and I didn't have any place to go. I didn't know what I needed to do. I felt like I was dying. I probably was. Went down there real early in the morning to emergencies so that I wouldn't have to sit there all day. They took me right in, took care of me. They told me 87.4% this year to live, and next year would be 47.4 for my mortality. And I asked her, did that have to do with what the liver transplant would be, or my life? And she goes, your life. I stood up and was like, oh. Mm-hmm. But now that I'm more stable, like I'm doing better now than I have for a whole year.
In the summer of 2011, CareOregon came to us with a really unique opportunity. They had created a list of the patients at Richmond Clinic who were CareOregon members who were demonstrating patterns of utilization and in using the ED, being admitted and readmitted to the hospital that looked like there might be an opportunity for either reduction in that utilization or modification of that utilization.
My name is Brian Edward Day. I'm 69 years old. I was disabled at the time that a TriMet bus hit me in a crosswalk. I had I had a double craniotomy brain surgery in 1977 and some other fun stuff on the way up to 2004 when bus 54, as the driver said, I'm sorry I didn't see you. No, he didn't. But that just to glove my leg was I'm not going to show you. And the physical conditions have been just like compounding during my life as a result of this injury, that injury. One injury begets another injury. So the challenge for me is just hang in there and keep on going.
Yeah. The first thing that CareOregon asked us was, what's happening here? Can you go to your PCPs and find out what they think about why these patients are going to the ED so often or going to the hospital so often or being admitted to the hospital? So we broke up the list and we sent that list to our PCPs, and we got responses that we could have probably expected, which was that the PCPs absolutely knew these patients were demonstrating these high utilization patterns. They felt at a loss for what to do about that.
If I needed help, I'd go to an emergency room, even though I had insurance now. I've had a lot of problems with fatigue, which causes mild seizures, and just getting my life in gear and coordinated. It took, I guess after I'd been to the hospital enough times, it's like, pardon me, a couple hundred.
Yeah.
That caught somebody's attention.
Yeah.
They often cited psychosocial comorbidities like substance dependence and abuse, mental health issues, and just issues pertaining and relating to poverty as being the reasons that were driving the behaviors, and they really felt that those were things that they did not have the power within their medical toolbox. So we collected all of that information, went back to CareOregon and presented that to our partners there, and they responded with another opportunity, which was to be a pilot site for a program that is now called the Health Resilience Specialist Program. It was formerly referred to as the Community Outreach Worker Program.
Having the health resiliency specialists in our clinic has changed how we work here in a couple of different ways. Having someone with a strong mental health background and a strong patient perspective, being a strong patient advocate, be able to work with our patients. It has also helped us understand the importance of a pharmacist. It's helped us understand the importance of wraparound care and wraparound services.
They gave us an opportunity to actually have an individual who could leave the confines of Richmond to go be with a patient at a time of need, whether that need was in the home or at the specialty office or at the hospital or at the ER.
They move the dial in the field. The teaching moments that can be captured happen in the field. They don't happen in the clinic.
They were able to be that fly on the wall at the patient's home or at the specialty visit or during the hospital admission, who could really observe how the patient was interfacing with the health system outside of when they were present at Richmond Clinic, and to be able to use that information to both feed back to the provider to say, hey, when the patient's at home, they actually have no idea how to use the medications. Or they were able to say that the patient was in the ER just in crisis, in panic mode, and really feed back to the provider that maybe we'd overlooked something to do with mental health or the patient's background, a trauma history we may have overlooked.
We get to see what has been destabilizing them, whether it's housing, whether it's a personal loss, whether it's, a father who recently used and didn't show up at a birthday party that re-triggered abdominal pain leading to recurrent ER admissions. It is that sort of patient perspective.
The longer the health resilience specialists were present and really being proactive about going and talking to providers on the fly, ducking into appointments, the more our providers began to really depend on them to be that surrogate family member in the room to help a patient get through a visit, get their needs met, prioritize what they wanted to talk about, and then follow through on those recommendations.
I went 10 years without any help, any meaningful help, but since being at Richmond, I'm beginning to get the meaningful help, and now things are beginning to come together, and I'm beginning to get the care that I've needed.
There has been such great collaboration between OHSU Richmond, OHSU, and CareOregon as the health plan. That collaboration happens on so many levels. It happens directly between the individuals involved. So we have 2 CareOregon employees, Lisa and Lori, who are actually sitting at desks at Richmond and who are known to our Richmond family as members of the Richmond Engagement and Community Health Team, otherwise known as the REACH team. So to our Richmond employees, Lisa and Lori appear to be just one of us, when in fact they're receiving all of this extraordinary management, oversight, and support from the health plan where they actually are employed.
The support around this program from CareOregon has been excellent. There is a multidisciplinary meeting where there's a lot of cross-fertilization as to how to help patients.
Part of our work is inviting people to work with us, working side by side, coordinating services, and once services are set up, we pull back a little bit. We're embedded in clinics, so we continue to provide ongoing support, but it's not as intensive because the goal is really to support the resiliency of you.
The Health Resilience Program had a special contract with Join to help people on the street who were really struggling, that had a lot of complex medical issues that just weren't getting addressed because they were on the streets and were just trying to survive.
Yeah, I feel sorry for all those people. Yeah. I say prayers for them all the time.
Yeah, so after working with Jeff for a short period, it was obvious we needed to get you housed.
Right.
So you could get your surgeries
have the surgery and all that
start
stuff.
Getting better.
Yeah.
Yeah.
The benefit of having individuals who look at our patients from a non-medical perspective and from much more of a life perspective, quality of life perspective, social perspective, has helped facilitate some of those conversations happening faster, and also getting patients the services they need at home faster that we might otherwise have spent 2 or 3 or 4 more hospitalizations getting to.
I was homeless and I needed to have a surgery, but they wouldn't give me surgery until I had a stable place to stay. We were talking and I said, yeah, the lady said she put me in the system, and then she was like, bing, it was like a light bulb above her head. She called. Within a week I met the man, and within less than 2 weeks they moved me in here, and they furnished the place, all that stuff.
What has been really powerful for Richmond Clinic is the fact that this team has evolved and the team has recognized what an amazing opportunity we have to be capturing patients while they are hospitalized to prevent that inevitable readmission.
As you can imagine, I do have a fair amount of pain. It wasn't until I started getting help from the dentist palliative care that Lisa arranged that the pain management returned. And now I'm a whole new man.
This week I'm attending on our inpatient service. It was remarkable to me how many times our REACH team and our health resilience specialists came, how many times we referenced them while we were rounding. So we have patients currently hospitalized who are engaged with Lisa and Lori and on whom we'll be relying to support that patient after they're discharged. As I was leaving the hospital, I got a call from Lisa. She wanted to talk about 2 other patients, one with whom she'd just had coffee, and she wanted to be sure I knew about issues that patient wanted to talk about at an appointment next week, as well as wanted to know if I could pick up some dressings from the hospital that a patient she would be visiting tomorrow would need to manage her leg wounds. And it was just striking to me how integrated Lisa and Lori are in the care of our patients. It's just absolutely incredible.
I'm doing better now than I have for years, even though I know I probably don't look it, but I'm in this chair. I wouldn't have this chair if it wasn't for Lisa's help. Obviously I'm doing better. I'm getting the best medical care of my life at Richmond Clinic. I have no complaints.
We started this program 2.5, almost 3 years ago, hiring a health resilience worker, Amy Vance. And she has been key to the program. She's continued to work with us. I cannot even imagine what would happen if we didn't have Amy.
If I think back to 3 years ago, prior to this program starting, and I ask myself, if somebody had walked into Richmond Clinic and said, who of your Richmond patients is in the hospital at OHSU right now, we would not have been able to answer that question at that moment. And now, if somebody walks into Richmond Clinic and asks that question, we know a lot about that. And that, to me, is probably the most important thing that happens at Richmond Clinic every day, is the awareness that we have about our most sick patients, the ones who are in the hospital, and the proactive work that we're doing to address their needs, to try to prevent them from having to go back into the hospital again. This is a huge paradigm shift for Richmond Clinic, and it would not have happened had the Health Resilience Specialty Program not landed on our doorstep. I truly believe that.